Today we are introducing a new discussion format. We will review previous legal cases related to ectopic pregnancies and analyze the decisions taken in each scenario. This will help us understand the medico-legal perspective. This will help us to understand the medico-legal perspectives, the rationale behind judgments, and how these lessons can guide us in our clinical practice. So this is the first case, which was in 2001. Srimati Vinita Ashok versus Lakshmi Hospital and others. Srimati Vinita Ashok filed a consumer complaint before NCDRC alleging medical negligence by Lakshmi Hospital and Dr. Warrior. The appellant went to the hospital for termination of pregnancy. She was second gravida para 1 post cesarean 8 months and was in second trimester of the current pregnancy. Laminaria tent was inserted for initiation of labor. The appellant was bleeding profusely and therefore they conducted laparotomy followed by hysterectomy. Dr. Santha Warrior informed the appellant's husband that it was a case of cervical ectopic pregnancy and her uterus had to be removed as a life-saving procedure. Now the allegation of the appellant are that the respondents had not acted with due care and caution in the performance of their duties. There was lack of necessary facilities and infrastructure at the hospital. The appellant pleaded that the dilatation curettage procedure was unnecessarily done on her, which led to the other problems resulting in loss of uterus at a very young age. The defense was that hysterectomy had to be resorted to save the life of the patient when the excessive bleeding started. The bleeding was not on account of any negligence in the diagnosis or on account of any faulty procedure adopted in the course of surgery. It was cervical pregnancy which had ruptured. Probably it was scar rupture, that's what I perceive. The outcome was no proof of negligence or deficiency in services. Verdict was not guilty and case was dismissed. This is the second case of Delhi, Dr. Kusum Sabharwal versus Sangeeta Agarwal and others on 11 January 2018. The complainant, Sangeeta Agarwal, approached Taravati Ramgopal Mehra Charitable Medical Center and consulted Dr. Kusum Sabharwal. She was diagnosed as pregnant via a pregnancy test. After her written consent, a medical termination of pregnancy was performed the same day and then discharged with medication. After 15 days, she returned with pain abdomen. Another ultrasound was done, which was reported normal, and she was treated symptomatically. Now the allegation is that despite continued discomfort, the OP allegedly ignored her repeated complaints and declined further examination. Few days later, she collapsed at home and was rushed to St. Stephen's Hospital in critical condition. Diagnosed with ruptured ectopic pregnancy, she underwent emergency surgery. 200 ml of clots were removed from the abdominal cavity. She alleged that the original MTP was negligently performed, resulting in prolonged suffering and danger to life. The defense was, since OP2, that is Dr. Kusum Sabharwal, is working in a charitable center, they stated that the complainant is not a consumer. Whatever amount has been paid to the medical center is actual expenses and it does not take any profit. Dr. Kusum Sabharwal is not employed by the hospital for providing medical treatment and she is a visiting consultant only. Dr. Kusum stated that there has been no negligence or breach in standard of care. The district forum found that Dr. Sabharwal failed to properly diagnose, manage the patient's post-MTP symptoms, held both OP1 and OP2 liable for medical negligence. A compensation of 1,50,000 was awarded and 5,000 against the litigation costs. The doctor went to the State Commission. On appeal by OPs, the State Commission upheld the district forum's order, dismissed the appeal. Then the case went to NCDRC. The commission examined the medical records, timelines, and actions taken, noted that the ruptured ectopic pregnancy should have been suspected and diagnosed earlier based on persistent symptoms. The histopathology report of MTP2 was not available. Held that the standard of care was not adequately met, so no jurisdictional or legal error was found in the findings of the lower flora. So verdict was guilty and punishment was granted. Now third case is complainant first consulted. This is Srimati Shikha Sharon versus Dr. Rajiv Sikand and others. Complainant first consulted Dr. Arti Luthra for MTP, who referred her to radiologist Dr. Sikand. Both Dr. Luthra and Dr. Sikand found no intrauterine pregnancy, and a suspicion of adnexal mass was made suggestive of ectopic pregnancy. This ultrasound was done free of cost. The complainant moved from Dehradun to Saharanpur, verbally informed the surgeon about ectopic pregnancy, got laparoscopy done from a surgeon which didn't show ectopic pregnancy. He rather performed an appendectomy on her. 2 weeks later, the ultrasound showed 8 weeks intrauterine pregnancy. Patient was forced to get MTP done due to medications consumed till then. Now, the allegation is that the complainant alleged that wrong ultrasound diagnosis of ectopic pregnancy by Dr. Sikand was made, leading to unnecessary surgery and later forced abortion due to medical reasons. The defense on the part of the doctors was that the patient purposely withheld a report of ultrasound as well as other facts associated with the case. She was in haste to terminate her pregnancy and did not do so after consulting gynecologist. No payment was taken for the tests performed, thus complaint is not maintainable. The outcome was that Dr. Sikand stated that the ultrasound findings were only suggestive, based on history by the patient. Additional tests were done free of charge. Surgery and MTP decisions were beyond his control and had to be decided by the gynecologist. The complainant withheld the key documents. The complainant didn't show the ultrasound report to the surgeon. Now, the findings noted were that there was no proof of negligence or deficiency in service, free service not covered under Consumer Protection Act, complainant dismissed as misconceived and based on concealment of facts, verdict was not guilty. The fourth case is Dr. Asha Garg versus Sarika and others. Background is that the complainant Sarika, para 0+1, previous ectopic salpingectomy, visited Dr. Asha Garg and with conception-related concerns, pain, and underwent several ultrasound and beta-HCG tests between this date. Ultrasound showed ruptured ectopic pregnancy, but Dr. Garg allegedly only prescribed vitamins and failed to act urgently. On July 8, 2018, Sarika was admitted to CMC Hospital, Ludhiana, where ultrasound showed ruptured ectopic and hemoperitoneum. Emergency surgery resulted in removal of the other tube also, severely affecting her fertility. Neglect in diagnosing and treating a self-threatening condition was made. Failure to correlate test results, conduct timely intervention, or refer for urgent surgery was noted. The defense was that the complainant had no ground to file the present complaint, and the same had been filed to defame the reputation of OP1 as well as to extort money from the appellant. The outcome was that expert testimonies confirmed that ultrasound indicated ruptured ectopic pregnancy and required immediate action. Dr. Garg admitted treating her symptoms only, not addressing the emergency condition. Failure to act promptly caused loss of reproductive organs and potential natural conception, demonstrating medical negligence. So, appeal was made, but it was dismissed. Negligence was established by the NCDRC. Again, an appeal was made, which was partly allowed. Compensation was enhanced from 2.5 lakhs to 5 lakhs, plus recovery of hospitalization and litigation costs. So, verdict was guilty. This is the last case, Dr. J.S. Pandhi versus Srimati Baljit Kaur. Complainant has had history of ectopic pregnancy. Right fallopian tube was removed in 2007. In August 2010, she presented with missed periods, spotting, and abdominal pain, a classic ectopic symptoms. An abdominal examination was done, which reported to be normal. She conveyed her problem telephonically to OP2, who ignored her call and advised her to continue with the same medicines. Did not advise serial ultrasound. On early diagnosis, she could have been subjected to medical management for ectopic. This is her complaint. The OP1, that is radiologist, ignored referring doctor's advice for TBS, performed only abdominal ultrasound. Later, he tampered with the documents and added ectopic pregnancy on ultrasound report with pen. Delayed detection of ectopic pregnancy was made until the rupture occurred. OP2 was a government doctor. He dismissed the symptoms, failed to recommend serial beta-HCG tests, and or insist on TBS despite patient's history. The OP3, that is the surgeon, performed laparoscopy and removed left tube, did not attempt conservative or fertility preserving treatment. Now, the defense was that the complaint was misconceived, frivolous, vexatious, and that complainant had cooked up the facts to extort illegal sum from him. No specific scientific and justified allegations with regard to the negligence or deficiency in providing services have been made by her against him. It was pleaded that he is a reputed qualified doctor having qualification of MBBS MD and had been running his clinic successfully for last number of years. So this was a failed defense. Outcome was ruptured ectopic pregnancy led to emergency surgery. Both fallopian tubes removed, leaving IVF as the only option. An earlier diagnosis could have helped. Ruptured ectopic would have resulted in death of the patient too. Patient sought rupees 20 lakh compensation for negligence, medical expenses, and mental agony. The negligence was established against OP1 for not performing TVS. Early detection via TVS could have avoided surgery and preserved fertility. Verdict was guilty. Thank you very much. Now we